Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. First thing first, thank Jennifer Lawless, Chair of the Political Science Department at the University of Virginia, for joining us earlier this morning to talk about all the implications of everything going on down in Washington, D.C., and the hold that Senator Ted Cruz has put on Governor Raimondo's nomination to serve as Commerce Secretary and what the implications and timing of that are. But let's go to Balzano, Italy. Rebecca Couto da Silva, thank you so much for joining us. It has been far too long.
It has. Thanks for having me.
So let's start with vaccination. Rhode Island is, depending on which ranking of how efficient we've been at getting our vaccinations out the door, we're ranked somewhere between either 43rd or 47th at per capita usage of our dosages. It's been a disjointed, failed program here in Rhode Island. At least we're consistent on that front. How are things going in Balzano and across Italy with the vaccination program?
Well, Italy's a bit mad at Balzano, but I do think we turned lemons into lemonade in a way. But basically, the first set of vaccinations were offered to healthcare workers. Because if one gets sick, they risk being a super spreader, and also that's one less person taking care of other people who need to be taken care of. And so many refused it that there were extra doses. But everything in Italy is sort of governed by very strict rules. So we had to ask Rome for the flexibility to start offering those doses to the over 80 group. And so now I think, like in our region, something like 56 of the 78 nursing homes have given the second dose to all the over 80s that have wanted it. We started at the same time as Europe, so any healthcare provider who wanted it should be able to have had the second dose by now. Although I never saw that hit the news. It definitely has been 3 weeks. So.
And you're mostly using the Moderna. AstraZeneca is being used, but for those only under 65 in most of the EU nations, right?
Yeah, I think that's how it is. There's always some story or another on it, but I do believe that's how it's going. Italy is following the guidance of the EU, but definitely the issue of which vaccine is touchy and hot and political, and obviously even a UK continental issue. Yeah,
of course. If it's in the EU, it's got to be controversial, and then add the UK to it, and it makes all the more fun. The Italian government has fallen. A new government is trying to be formed, just like America, right? And Mario Draghi, an economist, is trying to form a government, bringing together the different political entities within Italy. How is he doing?
Yeah, so they're looking at getting a technocratic government together is basically the idea. That it's just so everything is so politicized that let's get this technocrat in to sort of clean things up financially. And I think that's, I don't know, it's possible, but it's one of those things that I just think that there is not really any such thing as a technocrat anymore. It's all sort of political. And in some ways, it's nice to see that people are challenging and seeking for what they want. On the other hand, there's just a lot of stuff being guided by misinformation and things like anti-immigrant sentiment, and that's tough. I do think that Italy is one of the countries that's very burdened by heavy debt loads, and one of the only public debt. One of the only problems that Italy has, or let's say before the COVID hit, is the high levels of public debt. So the idea that these EU funds are coming in is something that's very touchy, because Italy doesn't see the EU as necessarily a friend or any lender as a friend. Italy contributes a lot to the EU, in terms of money, and perhaps it's like the student debt crisis where you've got the 7% interest rate and you're looking around and you're saying, no one's paying 7%. Why are you holding me to 7%? That's not fair, and it's holding my country down. And the EU's like, why don't you pay off your debt? Is it because it's at 7%? You know, and it's just sort of this cycle. And then at that point, it's hard to put a technocrat in, I think. It's hard to do anything because it has become just so politicized. So we'll see.
Let's go to Balzano. You're going back into lockdown, but you've also had significant complications when your daughter tested positive and now can't test out of being positive, right? Explain
Right.
this.
Well, so there are a couple of things. One, she's allowed to go out, go to school, all of that. She was released from quarantine. She was given a certificate that she's negative to COVID. But here we have something. So this test is a molecular test called a PCR test, is the legal test. And the rapid test is not considered to be a legal test. And so what happened is that on the 2nd, she tested positive to a rapid test. And even though it's not a legal test, it got us put into quarantine. The 9th, she tested positive on the PCR. The 16th
9th of December. Yeah.
The 16th, she tested dubio, which is doubt, on the PCR, which is positive, but not really positive. So on the 21st, I got a call from the people who supervise the quarantine, and they said, look, that shows a reduction in the viral load, and there's a rule that you can really only be isolated for 3 weeks, because in March and April, people were isolated for a very long time. So they're very conscious of letting you out after your 20 days. And so on the 21st, they said, well, we'll let her out the 21st, no big deal, because it went from positive to dubio, which shows us that she's turning the corner on it. So then I took her to her pediatrician, because even if the health service says that, she's not allowed to go back to school. Pediatrician does a rapid test on her, negative, sends her back to school with a certificate. There's a rule that if you want to go back to organized sports, you have to have a doctor's certificate. If you are COVID, that's just a rule always. So you always spend a lot of money every year just to be able to play sports. So for her to rejoin her Zoom classes on gymnastics, she has to get an echocardiogram, which she did, and do a doctor's visit where she wears all the diodes and does a force test on a bicycle, gets pulse ox taken, and does a spirometry, where the blowing out test. And we were supposed to do that this week, and so I went and I did it because I tested out with the PCR test. And they're like, oh, she doesn't have a PCR test. So she's, we can't do these tests on her. So to get a PCR test now, I would have to pay €100 and then wait another month, and technically would have to repeat the echocardiogram, which is also something like €100. None of this is covered by the medical insurance because it's not considered a medical necessity. I was like, if it's a heart test, how is it not a medical necessity? I get it.
So just to get the timing right, this started functionally the first week of December. It is now February 5th. It's 2.5 months later, and and she is completely stuck in limbo.
Yeah, she can't go back to sports unless, and she won't repeat the echocardiogram either. She's 11 years old. There's, all this touching on her chest. She said, I don't like that. And, and it's literally form over substance, because I had it after her. I tested out after her, and I have the certificate that I'm okay to go back to sports.
Is there a physician overseeing this restrictions who originally worked at the Department of Health in Rhode Island? Because it seems as chaotic as what is going on here.
Yeah, it's just shocking. It's so funny to me because I'm like, I got it from her. I healed after her. And then, the idea that I can't get a PCR test unless I go to a very expensive clinic is just, are you kidding me? There's got to be some sort of, I get it that you don't want parents rushing your kids back to sports. You don't want them to have a heart attack, but she's got the echocardiogram that's clear, and she's got the weeks and weeks of being healthy that are clear. So
you go back into lockdown. Have the variants, the UK variant and the South African or the Brazilian variants. The UK has begun to hit Italy. Have either of the
Yeah.
other two variants become factors? And are you seeing an increase in cases due to these more infectious variants?
So the UK variant even got us to not just Italy, but our province. Um, I haven't heard that the Brazilian or South African ones have. In Brazil, there's obviously a pretty strict travel restriction. So the very few people that could go and come are Brazilian citizens. And it's just not easy anyway because of the travel restrictions. There are really no flights. So there's not a lot of there aren't a lot of people going between Brazil and Italy right now, or even Brazil and Europe. So the UK version is definitely here. It's definitely close. One thing that we're doing, so we're actually, I don't know if you saw that in the European Union, they've designated deep red zones, and we're like a deep red zone here. But one thing that we're doing here is with the university, we're actually studying healthy populations. And so we had that weekend where everybody was invited to test, and something like 61% overall, 69% in my town got tested. And now they've actually got, they're continuing to do that on healthy populations. And so we have really high numbers. And it's sort of, we're in some way being punished for doing these studies. And in another way, we do have a lot of people here who are very, very anti-mask. There was a gathering of 200 people in a restaurant with capacity for 89 that got broken up recently, and something like 150 people were cited. We had strict rules about when you could cross from one region to another, and now, so people lied about it, and now you see they're being charged with felonies for lying about it. They lied about it over the holidays, and you'll see stories now that they're being charged with felonies for it. So it's my region especially. There are really big numbers, but it is hard to tell what is actual spread and what's our study. I guess the study should make it easy to tell that, but it's hard on a political level to convince people one way or the other that we definitely have these high numbers for that reason. In Italy, I just saw the other day that we had a very low rate of positives for people tested, something like 5%, 200,000 people tested, and a very small number were positive related to that 200,000. So that was a good sign, but it was one day, so who knows?
Listen, thank you so much. Sorry for all the difficulties with getting Olympia back in full motion and back at gymnastics. This virus and the implications of it just are touching everybody in so many complex ways. It's so difficult. Thank you for taking the time as always. And I always appreciate you checking in from Italy, and hopefully we can get you back next week as well. For everybody else, we'll have Dr. Fine at 1:30 with some significant updates on the vaccination program here in Rhode Island. And stay tuned for more news on Governor Raimondo's fate down in Washington, D.C. Thanks, everybody. Stay safe. Please, please wear your mask.